Welcome to Florida Joint Care Institute. My name is Dr. Jennifer Cook, and I'm excited that you have chosen us for your orthopedic needs. I wanted to give you a little bit of a background about our office building here, how we came to develop this area, and some of the services that we actually provide for our patients at this institution. We designed this office building and built it in 2011. Dr. Stephen Hamp and myself were the original partners, and we moved our old office, which was over in downtown Newport Richey, to this area, and we saw our first patients on November 11th of 2011. We had a third partner at that time, our emeritus partner, Dr. Henry Hamp, who actually started the orthopedic practice here over 30 years ago. He has subsequently retired, and Stephen and I have added 2 additional partners to complement the services that we provide. That is Dr. Jim Donovan, as well as Dr. Aaron Mates. And the 4 of us here today at Florida Joint Care Institute can take care of all of the orthopedic needs that you may have as a patient. We are also excited to be able to provide digital x-ray, which is virtually instantaneous here in our office, as well as physical therapy services that we have on the 2nd floor here. We typically will treat all of our postoperative patients here. That way we can keep a close eye on them and attend to any issues that may arise after the surgical procedure in a timely manner. I also wanted to give you a little bit of a background about myself and how I came here. I studied mechanical engineering at the University of Michigan as an undergraduate. There, I began working in a few different laboratories. First, I worked in an orthotics and prosthetics laboratory. Then I worked in a rehabilitation engineering laboratory. And then one summer, I got a fellowship to stay on and work in an orthopedic biomechanics laboratory. It was during that experience that I had the opportunity to go to the hospital and make rounds on patients, as well as observe in the operating room. It was at that time that I decided I wanted to pursue orthopedic surgery as a career. I had to take my pre-medical requisites at that time, and then I applied to medical school. I went to medical school with a combined program at Harvard and the Massachusetts Institute of Technology. This program was more research-focused with an emphasis on an engineering approach to medicine. During my time in medical school, I worked in an orthopedic mechanics laboratory as well. In this laboratory, we were studying polyethylene. That's the plastic component that's used in medical devices such as hip and knee replacements, and we were studying a process that made the plastic more durable. I'm excited to say that this plastic that I helped to work on in the laboratory is actually used in both hip and knee replacements today across the country. After completing my time at Harvard and MIT for my medical school, I then applied for orthopedic residency and matched at Harvard as well. I stayed there for 5 years, and then I elected to do an additional year in joint replacement and sports medicine surgery. That year was done at the Insull Scott Kelly Institute, which is in Manhattan. So I was there for a year refining my surgical techniques in both joint reconstruction and sports medicine surgery. After that time in the cold weather, I decided that I wanted to move someplace warm, and so I searched across the country and met Dr. Henry Hamp Sr., and he convinced me to come down here and join the practice, and so that's what brought me to this area here in Newport Richey and Trinity, Florida. I began practicing here in 2006, and so I have been here for over 12 years in private practice. My main areas of focus include joint replacement as well as sports medicine surgery as well as fracture surgery. I tend to concentrate on large joints, which would be the shoulder, hip, and knee. I do total knee replacements, total hip replacements, as well as total shoulder and reverse shoulder replacements. I also have an emphasis on revision knee replacement surgery as well. I can perform sports medicine cases such as shoulder arthroscopy with rotator cuff repair or labral repairs. I also do knee arthroscopy with ACL reconstruction or meniscal surgery, and I do fracture care as well. One thing that we're excited to offer patients now in 2019 is what we term outpatient joint replacement surgery. So joint reconstruction surgery has changed dramatically since I've been in practice. When we first used to do hip or knee replacements, these patients were typically admitted to the hospital for a minimum of 3 to 5 days. Nowadays, with some advancements in technique, as well as advancements in pain control and physical therapy, we have been able to shorten that duration of stay in the hospital, and now we can actually perform these procedures on an outpatient basis. So what that means for you as the patient is you don't even have to have a hospital stay in order to have your hip and knee replaced if you are an appropriate candidate. Now, not everyone would be an appropriate candidate for this surgical procedure. We need to make sure that someone has a coach that can help them at home, and they need to have minimal medical problems that may result in some potential problems post-operatively. But if you are a candidate, this is a great option for you. It helps to expedite your recovery, and it can also help with a significant reduction in cost to you and your insurance company. So there are multiple benefits to having this procedure done on an outpatient setting. Furthermore, because patients typically are healthy when they undergo these procedures, there's no reason that they need to be in a hospital setting, which typically has sick patients, and there are patients that have infections in the hospital. So to reduce the risk of potentially contamination or getting an infection, this is another reason why we think it's important to pursue this development of outpatient joint replacement surgery. On a personal level, I have many activities that I'm interested in. I am the chairman of the Good Samaritan Clinic, and that is a local free clinic for patients in Pasco County. I have served in that position for over a year at this point in time and been on the board as vice chair previously. I also participate in a program called the Perry Initiative, which is an outreach program for young women in the area. High school girls are invited to apply for this program, and it is a one-day class where we basically show them the advantages of being an engineer or an orthopedic surgeon. This is a hands-on experience that is co-sponsored by the Medical Center of Trinity, where we have different modules that we can practice orthopedic techniques such as suturing, or doing things like joint replacement surgery or scoliosis surgeries using bone models. This has been a great outreach program for young women in our community and has excited them to go into the fields of orthopedics as well as engineering. Thank you for coming to Florida Joint Care Institute today, and we hope that you have a wonderful patient experience.